How does a doctor decide when his or her patient can start putting weight on the leg after a fracture? Is it based on x-rays, a certain amount of time? Do they make it longer than necessary out of precaution? I addressed the topic of weight bearing after a fracture in this video. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is yet another part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my YouTube channel. And here it is. Here's the question I got recently. I had a tibial plateau fracture for a medial tibial plateau 7 weeks ago. I can now walk comfortably without crutches, but I haven't even been told I can put some weight on it by my surgeon. I can comfortably put weight on the leg after 7 weeks, but will continue with just one crutch and the brace to avoid future injuries in the knee or future issues in the knee. I have full range of motion and now need to work on building strength in the leg. Is the decision to bear weight based on pain tolerance, or do doctors wait for so many weeks as a precaution? Can they actually see differences in the bone healing off the x-ray results they take every 4 weeks? Okay, first of all, this information I'm about to provide, this answer, is not medical advice. It's just that. It's meant for information and educational purposes only. And this viewer clearly doesn't sound like they were told they could bear weight and they did it anyway. Would not recommend that one way or the other. Whatever your doctor says, just go with that advice in general. And if they don't address it and you want to know, make sure you ask. When you can bear weight after an injury, whether it's a tibial plateau fracture, which is the top part of the shin bone just below the knee, or really any part of your lower extremity, really it's not based on any one factor. It's certainly not based exactly on the amount of time. One, every bone and every part of bone has different amounts of time that it generally takes to heal. Two, factors like, was it treated surgically? Is there a plate and screws that are holding it in place, or a rod down the center of the bone that may actually take some of that stress off and actually make it easier to bear weight, make it advantageous to bear weight? And then the purpose of the x-rays is showing progression of healing so that you know, yes, it's healing the way it should, and lowers the risk that that weight may displace the fracture, basically setting you back to the beginning or potentially pushing you into the point that you need surgery. All of those play a role. But what we don't want to do is make that less likely to heal by putting pressure on it, disrupting the callus, the new bone formation, or even potentially further displacing the fracture. That's the purpose of getting the sequential x-rays. Make sure that the bone is continuing to line up the way it should. Make sure that new bone is being added appropriately. But is that 4 weeks or 6 weeks or 8 weeks or 12 weeks? Depends on all those factors, the bone and the type of bone, whether or not it was surgery and what type of surgery, sometimes how old you are, and then yes, x-rays showing new bone formation and that the fracture continues to line up well. So it's not an easy answer. It depends on all of those factors, and it's worth discussing that with your doctor, with your orthopedic surgeon every time you go there, if it's appropriate to start putting weight on it. Now, if you have an orthopedic injury and you want to hear about options other than surgery, options other than cortisone shots, you can click the link in the description under this video. You can fill out the contact form to schedule an appointment with me. I'd also love to hear about your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video like I did here. Make sure to subscribe to my YouTube channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.